I need to go over some important information about your instructor return for vital signs. The information for your instructor return for vital signs can be found in your week 2 folder, and then closer to week 5, it will also be listed there. So in your week 2 folder, there is a spot titled Instructor Practicum Return Vital Signs. Click into that, and this is where a lot of important information is housed. One of which is this normal range table. You must memorize these normals. You will be tested on these during your return. Depending on your instructor, you may handwrite these, you may be verbally asked to tell them, but you have to be able to tell your instructor the normals for teen, adult, and aged adults. If you do not know your normals, your instructor return rubric, found up here labeled Instructor Return Vital Signs 2021, tells you, let it get it pulled up, it's being slow as Christmas. It tells you that if you fail to correctly identify these, then a 10-point overall deduction from the return grade will occur. So it'll be put down here as minus 10 points, and this will count as the student's first return failure, regardless of the final grade for the return. This means that you can make it 88 and still fail this return if you do not know your normal values. If we don't know normal values, then there's no way for us to identify when things go wrong. Our hospitals require that we have documentation that you know your normal values for the safety of our patients. Therefore, if you're unable to identify the ranges of those normals, you will receive a 10-point overall deduction from this grade, and it will be counted as your first failure. You will be required to repeat the return to demonstrate mastery. So please, please, please memorize those normal values. They not only will help you on this return, but I can promise you that they will help you on your theory exam as well. The other thing that I want to point out here is this is how we as instructors are going to be grading you. Did you identify yourself to the patient? Did you say, "Hi, my name is Kayla Travis. I'm going to be your nurse today, and I'm here to take your vital signs." When you need to lift up the shirt of the patient to take the apical pulse, did you explain to the patient what you were about to do? That's what we're looking for there for those 5 points. For temperature, obtaining an accurate temperature using an electronic thermometer. If you take an oral, did you ask the appropriate questions? Have you had anything to eat or drink today in the last 30 minutes? Have you smoked? Have you had any dipped tobacco? Those type of questions. On tympanic, is there a reason I can't utilize this ear? If your patient's an adult, which we all are, then how would you lift your pinna? Do you pull it up and back, down and back? How do you position that ear to put in the thermometer? And the most important thing is that you put the thermometer cover on the electronic thermometer. We then will grade you on accurately measuring radial pulse, landmarking, meaning you have to tell me the 5 landmarks. The super strong notch down to the angle of Louis or Lewis, depending on who you ask the pronunciation for. Slide to the left to the 2nd intercostal space, walk to the 3rd, the 4th, and the 5th left midclavicular line. And then you measure it, so you're going to count it for a full minute. Most instructors will either count radial pulse while you're counting radial pulse, or they will count radial pulse while you're counting apical pulse to determine accuracy. You will then accurately measure the respiratory rate. Faculty do count at the same time as you. And we also want to make sure that we don't tell our patient or lead our patient to believe that we're counting their respiratory rate when we're doing it, because it then becomes abnormal. Correctly applying and reading a pulse oximeter, that has to be done after you've done your heart rate. The reason for this is your pulse oximeter does also give you your heart rate in addition to your oxygen saturation. So no doing it before you take your radial and apical pulse. You can take your blood pressure at this point, and again, I want to make a point that you do not have to do things in a specific order. Besides the radial pulse, apical pulse has to be done before your pulse ox. So if you want to start with your blood pressure, you're more than welcome to do so. But just know that there are a couple of things that have to be done in a specific order, and apical and radial should really be done close together for the fact of you want to make sure that you don't have a pulse deficit. With blood pressure, you do have to measure the cuff size to your patient's arm, so the bladder width has to be 40 to 60% of the patient's arm, and you have to estimate your systolic value. Wait 1 to 2 minutes before you accurately take the blood pressure. Remember that you want to control your dial. Don't release your air too quickly or too slowly. Both of these things can lead to an inadequate and inaccurate blood pressure. And then you, during this return, have to provide for privacy and comfort. Is your patient comfortable? Is the curtain pulled or is the door shut? Because we are going to have to take apical pulses, which means we're going up underneath the shirt. Standard precautions in medical asepsis: wash your hands before you touch your patient, clean your stethoscope. Utilizing proper body mechanics, your bed will need to come to your waist level, and your instructors will be showing you how to utilize those beds over the course of the next couple of weeks. And then completing your assignment in a reasonable time. You shouldn't take more than about 10 minutes to do a set of vital signs. Are you in complete dress code per the handbook? And did you remain professional? Did you use appropriate terms anatomically? As well as, did you talk to your patient and your instructor in a professional way? This is how you get your grade. You will need to take this form to your peer tutor lab because a classmate will need to sign it. When the instructor has looked up your peer tutor lab hours, they will write it in this blank down here. Now, the part of the grade I did not talk about is this 5 points, documenting your temperature, your pulse, your respirations, your pulse ox, and your blood pressure. How are you going to do that? Well, I'm going to show you. So there is actually a vital sign documentation, and this is going to be put into a quiz-like format. So you're going to need to bring your computer to lab on your return day because you're going to electronically fill this out before leaving the room. You won't do it in Word, you're going to do it in Lockdown Browser in a quiz type format. But I'm going to show you how you would document. Okay, so I'm going to enable editing, and I'm going to say that I took care of Sally Sue. The doctor doesn't really matter, room number doesn't matter, but my patient's name was Sally Sue. I took my vitals today on 8/31/2021. And I took them at, let's say, I took them at 12 o'clock. I then took an oral temperature, and I got 99.0 Fahrenheit orally. Okay. I took my radial pulse was 66 in the right radial. Apical pulse was 67. Respiratory rate was 13, and this one is probably where people lose the most points. So I got a blood pressure of 112/84 in the right arm in the sitting position. My O2 saturation was 99%, and I'm hoping that when everyone comes to do their return, you are breathing room air. Okay, so you can do room air or you can do room air. Okay. So you would type one of those two things and then your signature. So in my case, I'm Kayla Travis, and I'm going to pretend I'm a student. So my credentials is BSNS, Bachelor's of Science for Nursing Student. So this is how I would type my vitals and document them. They should not take you very long to do. So I've now entered week 5's folder, which is the week that you're doing your vital sign return. And I'm no longer in student preview because at this time you don't have access to that. But I do want to show you what this quiz will look like, okay? So I'm going to edit the test because it's not truly a test, but what you'll do is you will copy this table. You're just going to copy it down into your answer box that you type in and type into it just like I just did in the Microsoft Word document. So you fill out your patient's name and then fill out everything very similar to how I did it on the Word document. I hope this helps clear up some confusion if there was any, or just eases your anxiety about what is expected of you for your return.